Hi, my name is Anna. I go to Mohawk Trail Regional High School. I'm in ninth grade, and I'm going to be talking about youth substance use. The great news is that youth substance use, such as alcohol, marijuana, and other drugs, have been steadily going down since we started this survey in 2003. And in 2025, the rates are now at an all-time low. This is true not only for recent use, but also for whether students say they have ever used these substances in their lifetime. We also see big decreases in nicotine use, though there's been a small recent uptick in smokeless tobacco products thanks to new products like Zyn pouches that we are paying close attention to. This slide shows decreases for less commonly used substances like inhalants, psychedelics, cocaine, ecstasy, and heroin use. These are great declines, but drug and alcohol use is still an important issue. 1% of students using heroin is still far too many. We also know that substance use issues often become much more serious for young people in their 20s and 30s as the drugs on the market have become more easily available and stronger. This makes our prevention work with younger students that much more important. We are really happy that our 8th, 10th, and 12th grade substance use rates have continued to decline to the lowest rates we've ever measured.
Hi everybody, my name is Silas Jaguar. I go to Franklin Tech, and I'm going to be talking about the youth mental health portion of the 2025 Student Health Survey data. This first slide shows the big picture of many of the questions that our survey has asked about mental health over time. You can see that there were many increases in almost all of our measures for mental health problems, starting somewhere after 2012, leading to a peak in about 2022 to 2023. The good news is that we've started to see some improvements in many of these measures over the last 2 years. The top line here shows the symptoms of depression risk factor from the Prevention Needs Assessment survey that we typically run every 3 years. Our coalition set youth mental health and well-being as a priority after seeing increases in this risk factor since 2015. We reached our highest levels for this risk factor in 2022, immediately following the COVID-19 pandemic lockdown restrictions and remote learning, and have fortunately seen a major improvement since then for 2025. But while it's great news that the risk factor has improved, you can see that if we draw a line to ignore the 2022 peak, there's still a big overall increase in depressive symptoms compared to 2003 to 2012. These are 4 of the questions that go into the symptoms of depression risk factor. Each line represents a percentage of students that agree with each of these statements. At times, I am no good at all. I feel sad or depressed most days. Sometimes, I think life is not worth it. And all in all, I am inclined to think that I am a failure. These are significant questions, and this year nearly 60% or more than 4 in 7 students were struggling with at least one of them. So when we separate the line of symptoms of depression into different student groups, we see a really big difference between gender identities. Here are cisgender boys, or non-transgender boys, at the bottom in blue, and cisgender girls are higher in orange with a big difference between the two. And we've seen even higher rates in gender nonconforming or gender divergent students. But the good news is, again, we have been seeing some improvements since the 2022 peak. Likewise, you can see a big difference between straight students and LGBTQ students, where LGBTQ students are experiencing much higher rates of depressive symptoms. Now, returning to the big picture, here's that first slide again. We'd really love to know what you think is helping to lead to some of these more recent improvements we're seeing, and what might still be contributing to overall higher rates compared to a decade ago.